Tonight, on the front lines, how New Hampshire's community health centers are battling chronic diseases and winning. We'll talk to Dr. William Kassler about this remarkable achievement. Taking care of business, how New Hampshire's business community is stepping up to support their local community health centers.
The number one concern of businesses of all sizes in our membership and outside of our membership is the rising cost of healthcare and health insurance.
And our patient of the week, how one woman turned her health and life around with support from the community health center and her own commitment to make a change.
Because of the value that I felt that I had at the community health center, it gave me confidence to pursue other areas. And it gave me I could hold my head up high again.
Reporting this morning from Concord, Diane Stoyer.
Good morning. We begin with one of the leading causes of escalating healthcare costs in this country, the epidemic of chronic disease. According to the CDC, more than 75% of healthcare costs are due to diabetes and other chronic conditions. Well, New Hampshire's community health centers have seen enough and are doing something about it. We go to Sean Tester, reporting from the front lines.
At Ammonoosuc Community Health Services in Littleton, New Hampshire, a miracle of sorts is happening. Healthcare costs, emergency department visits, and inpatient hospitalizations of their diabetic patients are all dropping.
In 2009, Ammonoosuc Community Health Services was asked by the U.S. Department of Health and Human Services to participate in a pharmacy collaborative. This clinical pharmacy collaborative gave us an opportunity to further integrate our behavioral, medical, and pharmaceutical care of our patients in the context of a patient-centered medical home. In order to do that, we focused on our 62 diabetics who had 12 or more medications that they had to manage to take care of their health. And we put a team together that was comprised of a physician, myself, a patient navigator who is also a pharmacy technician, and a pharmacy technician who is also a certified medical assistant. As a result of this multidisciplinary team effort to enable patients to better understand the medications they're taking, we realized in reviewing the medications with the patient that there were instances that they could legitimately take fewer medications. And as a result, at the end of a year, we started with 62 diabetics who had 12 or more medications on their active medication list. And at the end of the year, there were only 30-some who still had 12 or more meds on their active medication list. And that makes it simpler for patients to take their medications, and it saves the healthcare system money in not taking medications that are no longer necessary. So that was one of our key findings. In addition to that, upon review of the data, we looked at emergency department use for non-trauma, and we looked at hospitalizations for non-trauma. And when we looked at the data, we realized that from the prior year to the collaborative to a year after the collaborative, there was a 22% decrease in hospitalizations and a 32% decrease in emergency department use. So that's the value in integrating pharmacy services with medical and with behavioral, that patients better understand how to take their medications. They may be able to take fewer because we've reviewed and reconciled the medications they take. And we can decrease the likelihood that they'll end up at the emergency department or admitted as a result of not taking their medications properly.
The CHC Patient-Centered Medical Home is producing outcomes like this both locally and across the country. And it's especially encouraging that efforts are being made to improve the health and health outcomes for those with the costliest conditions. Back to you, Diane.
Thank you, Sean. We turn now to CHC Morning News medical correspondent Dr. William Kassler to understand why chronic disease management programs like Ammonoosuc's are successful in improving the health of patients and lowering healthcare costs. Dr. Kassler is Chief Medical Officer for the New England region for the Centers for Medicare and Medicaid Services and President of the New Hampshire Medical Society. Dr. Kassler, welcome to the program. What is chronic disease management and why is it so successful?
Our current healthcare system is quite fractured into many different pieces. We have multiple providers. We have doctors and nurses and specialists, primary care providers, pharmacists, therapists, the whole range of people who care for patients. We also have different venues of care between hospitals and outpatient clinics and doctors' offices, ambulatory surgery centers and pharmacies. And none of these systems really talk to each other well, let alone communicate with all of the different services that can happen within the community to support a patient. So it's not particularly supportive to patients and their families and caregivers, and it's not particularly supportive to the physicians and nurses that are caring for the patients. So disease management is the idea that patients will do better. There'll be less medical errors. There'll be better preventive services. There'll be less unnecessary, redundant, and expensive care if that care is coordinated. So disease management is the notion that if we can coordinate care and we can empower patients to take a greater role in their care, that care will improve.
6 of New Hampshire's community health centers have achieved National Centers on Quality Assurance, or NCQA, Level 3 designation as patient-centered medical homes. Several others are going through that process now. What does this recognition mean, and why is it important for purposes of chronic disease management?
The disappointment to date of disease management has been a real failure to live up to its true potential. And many people feel that's because it's been imposed from an outside organization onto the practice. The idea is that if a practice can bring in that expertise, if they can do care coordination, if they can have the health information technology necessary to do that, if they use their own data, their own relationships with their patients, that disease management will be far more effective. But not every practice can do that. In order to do that, a practice has to adapt and redesign. They have to use more sophisticated technology. They have to have better access, better hours. They have to have skills in care coordination and disease management. And the NCQA certification is an outside certification. It's an outside indication that that practice has gone through the effort, has gone through the training and the transformation to truly become a medical home. And it offers a sense of security to patients and payers that that practice has the skills to do a better job.
Finally, Dr. Kassler, from your perspective, why are community health centers essential healthcare providers for the state of New Hampshire?
Community health centers have been an important safety net provider for quite a while. They have provided access to care for populations that traditionally have not had that access. If we look to where care is going, better use of health information technology, better care coordination, better access and referral to community psychosocial services, the community health centers have a tremendous head start. They've been doing that since its inception because it's been an integral part of their mission.
Thank you for your insight, Dr. William Kassler.
Thank you, Diane. It's been a pleasure.
We turn now to New Hampshire's business community and how it is stepping up to support community health centers. According to a study by Capital Inc. in 2009, it is estimated that in New Hampshire, the total economic impact of the community health centers was $77 million. Chief Economic Correspondent Earl Pierce reporting from the State House on the ways in which 3 of New Hampshire's state and local business leaders are taking care of business and making a real difference.
Thank you, Diane. Jim Roche is president of New Hampshire's Business and Industry Association. A recent survey of their members revealed their number one concern as being the high cost of health care and health insurance. Jim spoke to CHC Morning News about this priority and how it led them to advocate on behalf of publicly funded health care providers like the community health centers at the State House this last session.
I'm Jim Roche. I run the Business and Industry Association of New Hampshire. We have roughly 400 members statewide, dues-paying members. We have another 2,500 small business members that participate in our Capital Connect program. So in totality, we're interacting and representing about 3,700 business leaders, business executives, owners, managers throughout the state. We weigh in on dozens of issues every year, but again this year the number one concern of businesses of all sizes in our membership and outside of our membership is the rising cost of health care and health insurance. The network of community health centers in New Hampshire provides a real service to people throughout the state. They provide high quality care, very cost effective care. They're an important part of the fabric of New Hampshire's healthcare network, and that's why we weighed in support of the community health centers and the hospitals last session, and we'll do so again. To be able to access high quality health care is very important for businesses all over the state. Again, a healthy and productive workforce contributes to the economy, contributes to tax revenue. It's just an important piece of the New Hampshire advantage.
My name is Peter Pelletier. I own my own business, which is an employee benefits and financial planning firm here in Intervale, New Hampshire. I am also president of the local Rotary Club. Very strongly believe in giving back to the community. I mean, the motto of Rotary is service above self, and the members of this club take that completely to heart. Patricia McMurray came and spoke to our organization a couple months ago. We also have a couple of doctors in our club, and the president of the local hospital, the CEO, is also a member of our organization. So White Mountain Community Health was known to us. Patricia's focus was on the Medication Bridge Program. The Medication Bridge Program is helping low-income or individuals that need medications that can't afford to go to the CVS pharmacy or the Walgreens or whatever and pay the retail price. We felt there was so much value in this that we made the conscious decision and the vote, and it was a unanimous vote, to fund it for 3 years. We felt this was a way that we could have an impact to a large number of people as opposed to a large impact with a small number of people. To know that as an individual in this community, I can go into White Mountain Community Health and have my prescriptions needs taken care of. We just know that reached out and touched a lot of people's lives, and it was as simple as that.
Goodwin Community Health Center in Somersworth is another community health center who has received an outpouring of support from local businesses in their area. Dr. Puneet Kocher is Vice President of the New Hampshire Dental Society and has a private dental practice called Alliance for Dental Care in the neighboring town of Rochester. Goodwin Community Health serves approximately 8,000 patients for primary care, 2,500 of which receive on-site dental services. This is in large measure due to the generosity from small businesses like Dr. Kocher's.
I'm Dr. Puneet Kocher. I practice in Rochester, New Hampshire with my partner, Dr. Renee Goodspeed. Our practice is Alliance for Dental Care, which was established by Dr. Lorian almost 50 years ago. Oral health is linked to overall health of the individual, and that's been shown by a lot of research, a lot of studies. It's come out now that pregnant women with oral problems or oral diseases can lead to preterm deliveries, and diabetes is linked to oral health. Cancer can be found now detected in early stages in the mouth. We were aware of the Goodwin Community Health, so we visited them. They came over to see us, and we decided, we should probably work together. That might help both us and them and benefit the patients. So we decided, okay, whenever they're in need or they have somebody who needs to be seen urgently, we'll cover for them. And if we think that there are patients who would benefit from going to Goodwin Community Health, we would send them across. And that's how we started working together. So besides us doing all the things we can, we still cannot cover the whole community. So we realized Goodwin Community Health Center is another opportunity for people to get care. Plus they look at medical also, so they have the facilities available for patients to get all the care they need. So when the Goodwin Community Health was raising funds to build the new building, we decided we'll make a contribution just in the name of our founder and our practice, Alliance for Dental Care, so we donated the dental wing. I think any community health center, you can say it's almost like a small business in the community because they are employing people, they are buying their supplies or their equipment from the local businesses. So that's again adding in the economy. So all the small businesses are still benefiting from them being there. I think it's a win-win for a community.
As you can see, the support for New Hampshire's community health centers from the business sector is wide-ranging and diverse. As these health centers are called upon to serve more patients under state health reform efforts like Medicaid care management, the need for continued support and investment will be critical for them to maintain their high standards of care in the years to come. Back to you, Diane.
Thank you, Earl, for that exclusive report. Now a short break, and when we return, our patient of the week.
Don't you love the warmth and comfort a Shruggy gives you after a long day at the office? Do you wish you could enjoy that level of comfort all day long, even at the office? Well, have we got the perfect solution for you, Shruggy Business Wear. Business suits are boring, and they take too much time to put on in the morning. But Shruggy Business Wear is easy to put on and comes in a variety of professional styles and colors sure to impress any CEO, business client, or member of the New Hampshire Legislature. And what's more is you'll be warm and cozy all day long. Shruggy Business Wear comes in both men's and women's classic styles. Shruggy for men gives an air of sophistication, while Shruggy for women provides the smart and stylish appearance that others in the office will be envious of as you climb the corporate ladder. Also, try our Shruggy MD line, perfect for all medical professionals. So act now. Don't delay. Shruggy Business Wear is flying off the shelves. Shruggy Business Wear is not a real product, and the taping of this commercial has not been authorized by the makers of Shruggy. Any attempt to reproduce, resell, or recreate Shruggy or Shruggy Business Wear would be absolutely ridiculous and should never be attempted.
And finally, our patient of the week. Reporting this morning on one of the health center's many patient success stories is our Senior Health Public Policy Editor, Tess Kenning, Executive Director of Bi-State Primary Care Association, a nonprofit charitable organization working to improve access to healthcare services for the people of New Hampshire and whose members include 16 of New Hampshire's community health centers. Welcome, Tess.
Thank you, Diane. It's a pleasure to be back in the studio with you. This special segment of our newscast is always inspiring. Bi-State works to promote access to effective and affordable primary and preventive services for everyone in New Hampshire and Vermont, with special emphasis on the underserved. We proudly witness our state's amazing patient stories, whose positive health outcomes are a direct result of their personal commitment to improve their health, combined with support from the skilled providers and staff at their local community health center.
My name is Carol O'Keefe, and I'm a substitute teacher for K to 6th grade in the District of Manchester. I'm born and raised on Long Island, and I had worked for a family business, and I had coverage then. But when I left, I was a healthy woman, so I just let it go, and I just mushroomed. I just didn't realize how many years went by that I didn't have a doctor. I was forgetting things, and my daughter was talking to me and saying, "Mom, I think you should see a doctor because I think you may have what my father, which she calls Papa, had." A wonderful woman spoke with me and said, "What I think, if you're worrying about that, I think before we do anything, I think we should send you to a doctor." And then she said, "And I have a list of places that you should go, but I have one in particular that I think you would like to go to." And it was the Manchester Community Health Center. And I rolled my eyes, at her because I was used to a certain level of doctoring that was not in this category that I thought. So, but I did as I was told because I really wanted to find out, how my health was. So I made the appointment and I walked in, and it really, literally, it blew my mind. It was new at the time. It was very, very clean, and the people were very nice. And then I saw the doctor. He was a man of many talents. I mean, I was so used to going to a doctor, and the doctor would refer me to another doctor for whatever category it was. And this doctor did everything. It was just amazing. Whoever walks in there, they get the same quality of care, and that's beautiful. So Ed George called me on the phone and said, I'd like to ask you something. Would you like to come in for just talk? And I said, I certainly would. And then I did, and I went over there, and he said, well, we have a wonderful woman who's retiring. Would you like to be secretary of the board? because of the value that I felt that I had at the community health center, it gave me confidence to pursue other areas. And it gave me I could hold my head up high again. I asked if I could be on my church's parish council, and that was huge for me. I wanted to join a choir again that I had been, and I hadn't done that in years and years. So I'm singing again. So it really was very influential in my overall well-being. So
Carol, with support and regular visits to the health center, saw remarkable improvements in her health, her wellness, and her total quality of life. What an inspiring story. And while Carol O'Keefe is our patient of the week, she is just one of approximately 125,000 patients seen at community health centers all across New Hampshire, from Colebrook to Nashua, from Portsmouth to Newport. There's a community health center near you, and the doors are open for everyone. If you or someone you know share Bi-State's vision of healthy individuals and communities as a result of quality health care for all, and is in need of a doctor or a primary care provider, please visit Bi-State's website at www.bistatepca.org to find a community health center near you and start living a healthier life today. Diane?
Thank you, Tess. What an inspiring story. And thank those of you who joined us this morning. From all of us here at CHC Morning News, have a wonderful day.